Hello, and welcome to today's podcast. In today's interaction, I'd love to think it is that we're discussing important issues, important bioethical concerns. In today's issue, we're going to be discussing the matter of genetic counseling. Now, my previous podcasts have addressed possible testing for diseases that are inheritable. My first podcast was called Genetic Diseases. And these are diseases that are passed on in our genes onto our children and how it affects them and our understanding and what we can do about them. And then in my second podcast, I addressed the matter of using gene treatments to cure diseases. So these inheritable diseases, we now have, as you learned in my previous podcast, gene technology mechanism that can splice and get rid of the bad genes and so create healthy offspring going forward. And so in today's podcast, I wish to look at how these specific scientific developments and what we have learned from studying our physical makeup and our genes can be helpful and so serve us through education, through counseling, serve us well to make us all be healthier, have healthier offspring, and make this world a better place. And so, in other words, genetic counseling forms a link between our genetic knowledge and the care of patients on one hand, and on the other hand, the choices that we make when we decide to have children. It links the two. Our genetic knowledge, what we need to think about when we care for persons, and then how that is linked to our decision making when we have children, and the knowledge that must be considered in this regard. And so you may ask, what is genetic counseling? Well, it is in fact a process of communication. It is communicating about diagnosis, about explanations, and the options for you to choose. That is genetic counseling. And so by definition, it is a communication of information about diagnosed genetic conditions in a way that allows persons to make a decision while protecting the emotional and ethical aspects involved in the process. And you can understand why. If you're going to have children, and the children may fall ill and die, there's going to be an emotional aspect to it. But the way we make decisions also have an ethical aspect to it. And so we're going to deal with genetic counseling in this podcast, and then in my next podcast, we'll deal with the ethical aspects that are important in our consideration. So let's start with the scope of genetic testing. For us to counsel, we have to test to know what's going on and so be able to advise persons. And so with the scientific advances that we have made, it is now possible to use several DNA tests to be able to do a number of things. One, to establish a diagnosis of hereditable and congenital diseases that affect patients with much certainty and precision. We can do that with certainty and precision. We can know exactly what is being passed on through our genes and how it will affect persons. Two, the DNA tests can also help us to predict the probability of the development of disease in individuals as well as in families, even though they may not have yet been affected. In other words, they look healthy, everything seems fine, but the testing tells us the probability that disease will develop later on because the genes have been passed on into them to be manifested later on. And I'll discuss that when we come to manifestation of genes. And so testing, I'm talking about the scope of the testing, DNA testing may also allow us to take measures to alleviate or reduce the clinical risk or expression of particular hereditary diseases. and to decrease the risk of their development and possible prevent these diseases. This may be done through monitoring and going monitoring throughout childhood as the person grows. It may be early clinical diagnosis, spot it early when it begins to show, and then somatic gene treatment, which I discussed extensively in my last podcast, using gene treatment to splice, cut out the bad gene, and allow the healthy part to be manifested. That we dealt with in our last podcast. And additional tests, the DNA test may also help us to predict the birth of an offspring with a genetic disease, and so allow decisions to be made regarding the fate of the fetus, regarding measures to be taken at birth, or the voluntary interruption of the pregnancy, if the malformation is so severe that the child may actually die within the first few weeks or months after being born. All of these decisions would be deliberated, counseled, once we discover what type of gene is present and what harm is likely to occur to the offspring. And then DNA tests, finally, can also, with the scientific knowledge and ability that we now have, we are able to offer a means for avoiding conception, avoiding bringing a severely disabled child into the world. It's an option, not necessarily a choice, but we are able to test to be able to predict that, and so advise, counsel on that. Or further, to avoid the implantation of embryos that are known to have genetic diseases into a woman's womb. In other words, we could, with the technology available now, select those fertilized eggs that have no abnormality and discard the ones that are abnormal and only put the healthy ones, implant them into the woman's womb to grow, to become a child. Those are all possibilities. We're not saying it's your choice. People have moral choices, but we're telling the scientific advances are now there in place for that. And so all of these processes involve premarital counseling persons before they get married, the process of selective implantation, that you can select the ones that are normal fertilized eggs for implantation, or the possibility of sterilization. All of these are options that can come out of the genetic counseling, so persons can make wise decisions for themselves and for their family. So, the process of genetic testing should always, as far as possible, be accompanied by genetic counseling. We always, if we're going to intervene, if we're going to counsel, if we're going to advise, then we have to do the test first, genetic testing. And then that leads to genetic counseling. Genetic testing will have the scope to communicate information as well as possible options to patients, options to parents, and options to their families. Genetic counseling is a medical act concerning a condition of a disease for which a patient or a mother of a child yet to be born or a family member may seek help from a medical professional. And genetic counseling provides that advice, that knowledge, that expert communication in regards to these genetic diseases. Consequently, genetic counseling ought to provide support in reaching decisions about the options that you have. Further, the extent of genetic counseling may progressively widen because as more genetic testing will be likely be done as new genes and the effects of particular genes combinations are discovered. In other words, we're constantly gaining knowledge because new tests are being developed and therefore new understanding, new diseases that are passed on are being discovered. And so the scope of genetic counseling will widen as these additional knowledge come into the mainstream with what we already know at this present time. These new gene probes, and please note this term, gene probes or DNA probes can be used to identify abnormal genes at the molecular level. And so new gene probes would add to the already known 3,000 genetic diseases which come from only 5% of all human genes. Let me repeat that. Of all our genes, only 5% of them have been found to be abnormal in many persons. Yet these 5% of genes around the world have caused 3,000 genetic diseases. In other words, the remaining 95% of our genes are normally healthy. But the 5% that can pass on diseases have been known to pass on over 3,000 diseases, genetic diseases, depending on various factors that I will discuss a bit later on. And so in the future, genetic counseling may extend to families with a history of diseases such as cancer, pregnancy miscarriages, and psychiatric conditions. The counsel may also be extended to populations at risk due to their reproductive age, persons wishing to get pregnant later on in life, age 45, 50. Genetic counseling can provide that type of advice. Or whether they've been exposed to radiation in their environment. Genetic counseling can also tell them the risk of the radiation causing perhaps cancer in their offspring and so on. Or counseling in regards to the effects of their lifestyle or to particular geographical considerations. For example, in areas that have a high prevalence of certain genetic diseases. We know, for instance, that beta thalassemia has a high prevalence in the countries of Cyprus and Sardinia. And we know that Tay-Sachs disease, a type of neurological inherited disease, exists in Jews of Eastern European origin. And so these are a part of the genetic counseling that can be carried out. And of course, genetic counseling may also be provided to populations at large, in which we conduct particular screening programs, and what has been called supermarket genetic testing may occur. This term means getting genetic testing in places like supermarkets, the way you can now get your blood pressure tested in a supermarket or similar places. This is to come, but it can occur that we can get genetic tests done in certain places as a part of screening large numbers of people brought together to find out what genetic predispositions they may have running in their genes. And so while such screening programs may raise social concerns, such as discrimination and so on, we also should realize that these screening programs must be weighed against the potential health benefits that may occur. It's a balancing effect. Health is beneficial, and we also wish to discover those things that may affect a person's health. And so if we look at scientific research, we should note that while many aspects of genetic counseling falls within the scope of medical professional practice, what the doctor, nurse, or counseling health professional may tell you, some aspects fall within the realm of scientific research, since the knowledge about genes that may cause human diseases include the limits of normal variability of genes and the many forms they take. All of this we're discovering by doing scientific research. Their variable, their structure, variability of their structure, the variability of the forms that they take, how they're passed on, as well as their interaction with environmental factors, as well as other genes. Genes may interact with other genes. Our knowledge about all of this is evolving. And so our knowledge and understanding is continually growing. So we should be aware of this. And so this continual updating of our knowledge should also be explained when we conduct sessions of genetic counseling. We tell persons about what we know now, the state of knowledge, but tell them that ongoing research is adding new knowledge that will add to our understanding of how genes interact with each other and what new diseases we found were actually being produced through inherited genes. And so the process is ongoing. And so we may ask, who are the persons who are to be counseled? Well, the way in which the practical options are communicated to persons who are counseled is very important. This is because the matter touches on moral, social, as well as traditional preconceptions. In other words, our values, our moral values, our beliefs, the social, what goes on in our society, as well as traditional preconcepts, what we traditionally think is the cause of life, purpose of life, how we interact. We come with certain preconceptions, and we all have different levels of understanding of scientific knowledge, scientific development. All of these are a part of our preconceptions. And so we must stress that, therefore, that genetic counseling has to be done within a firm ethical framework that is conscious of all of these moral, social, and traditional preconceptions. And I will deal with ethical framework in the next podcast. So today we'll focus on the specific aspect of genetic counseling. So this will include communicating the beneficial aspects of genetic testing to persons who wish to be tested, the better assessment of genetic risks in order to reassure the persons that wish to be tested, as well as the possibility of being prepared for intervening. Once we test, we would wish to intervene to correct anything that we discover that may cause harm. And so we advise that the safer potential for persons that counseling presents for having a healthy reproduction. In other words, counseling would help persons to make decisions to have healthier offsprings. Once we learn about the way genes are passed on, which genes may run in our families, and therefore produce healthier offsprings. And so all of these persons could be counseled through this process of genetic counseling. So how do we get about to provide the counseling? That's because we do genetic testing. And the sources for samples for human genetic testing include testing blood or taking tissue swab from newborn children or from adults, taking swabs from inside their mouth, in the cheek. And these may be, doing that testing may be prompted by us seeing a visible disease, or by a family history of a particular disease, or by discovery during a screening program. As I said, screening large populations for particular possible diseases. We take these samples, we test, and we discover that this exists within a person's lineage, that they will pass on through their genes to their children. We can also get human testing for genetic testing by prenatal testing, which is done in utero, that is, meaning in the womb. We take samples from the womb. We can do echography ultrasound, taking ultrasound pictures of the womb. We can extract fetal cells from the amniotic fluid that surrounds the growing fetus in the womb. In other words, a fine point needle goes into the womb, takes some of the fluid that will have the fetal cells, and then the cells are examined for their genetic makeup. Or we can also get samples from the fetal blood, or blood from the fetus itself, or tissue sampling from the chorionic villi, which lines the placenta during the first trimester. In other words, inside the womb, during the first 3 months of pregnancy, the placenta will have villi that supplies the nutrients to the developing fetus. So we can take samples from the villi, the chorionic villi, to test for the genetic diseases. And so, premarital genetic testing and counseling persons before they get married is aimed at detecting the carriers of certain genes which present a distinct possibility of causing inherited diseases, with the consequences of counseling such couples not to have children together. In other words, The testing, we get the knowledge, we then advise couples as to the risk that they carry. So they have the option if the child is going to be severely deformed or die soon after birth, then they not have children together. Not that they don't get married, love will cause them to get married, but they may choose to adopt rather than have children of their own if they carry particular genes that will cause severe malformations in the child when born. And that then leads us to look at what we call genetic alterations relevant to counseling. In other words, what exists in a hierarchy of likelihood of certain diseases, and then we counsel about that. So we should know that genetic counseling should advise persons of the different levels of severity that exist among abnormal genes. As I said before, 5% of our genes can cause 3,000 genetic diseases. But these diseases vary in severity. It may be mild or it may be so severe that it results in early death. And so there are 5 levels of severity. Level 1, these are the most lethal. These are deadly. These diseases, inherited diseases, are deadly in childhood or may produce serious malformations such as cystic fibrosis, which severely affects the tissues of the lungs and other organs, resulting in severe suffering and persons after birth hardly being able to live past the age of 25 years due to the severe fibrosis of their lungs and other organs that are needed to keep them alive. And so these category 1 are regarded as lethal. And so we would not want parents or potential parents to have children and lose children so early in life. It causes severe parental anguish, depression, and so on. So we have to counsel them if they carry these particular genes. Level 1. There is also level 2. These are hereditary diseases that are viable if treated. In other words, the children can survive if treated. Level 1, they won't survive. Level 2, they can survive if treated. And this consists of inherited diseases such as hemophilia, which you may remember I described before in podcast 2. And this can cause bleeding to death since the blood does not close off a wound. In other words, persons with hemophilia, when they get a cut, they just bleed and can bleed to death. You and I, when we get a cut, a clot forms and closes off the wound and we stop bleeding. There's also the hereditary disease of galactosemia, where the body produces too much, causes a buildup of the sugar in this bloodstream called galactose. And so once there's too much galactose in the blood, it results in complications such as brain damage, such as cataracts in the eye, such as kidney failure, and in an enlarged liver. And so if left untreated, as many as 75% of infants who were born with galactosemia will die. And so their parents or potential parents have to be advised about this possibility if they have inherited genes that will cause their children to fall into category 2. We have to advise them of that. Then there is category 3. These are the genetic diseases that appear later on in life, such as hypercholesterolemia, which is high cholesterol, that runs in families with an average age of onset being between 30 and 40 years old. In other words, they go through normal young adulthood, 10, 20, age 30, no high cholesterol. They're still eating the same types of food, same type of exercise, diet, and so on. But by age 40, they develop high cholesterol. Why is that so? Because they had the genes that would cause it to manifest itself later on in life. And so these genetic diseases in category 3 are of that type. Another category in this type is Alzheimer's disease, which comes on later in life. Persons having the genes for Alzheimer's will see beyond age 50, 60, 70, the onset of Alzheimer's runs in the family. And so we have to be aware of this category where persons who can pass on these diseases should know that their offspring may develop high cholesterol or Alzheimer's at an earlier age than the average population. Then there is category 4. In this category, genetic counselors have it difficult to explain what are called predisposition genes. What do we mean by that? The possession of these genes predisposes the persons to specific diseases, such as cancer of the breast. We know that cancer of the breast runs in some people's families, and so genetic counselors have to counsel about that. So they have cancers of the breast, cancer of the bladder, cancer of the skin, a condition called spondyloarthritis, which is genetic, particular type of arthritis that is passed on in the genes, as well as mental illness such as schizophrenia. We know that schizophrenia runs in certain families. And so all of these are what are called predisposition genes. They're passed on in the family, and the offspring may develop these diseases later on in life. Cancer of the breast, cancer of the bladder, cancer of the skin, and so on, schizophrenia. Then there is a final category, the fifth category, that is called what genes that cause multifactorial diseases. Multifactorial diseases we all know about. These include cardiovascular diseases and diabetes. Many causes causing diabetes, many causes causing heart attacks, and so on. There are some causes, however, that are genetic. They are passed on in the genes, and so these persons have early heart attacks in life or early diabetes that are due to genes, not due to their living conditions, not due to what they eat or the environment, due to their genes. And so that's category 5. And so you may ask, what are the effects of these classifications? If we look at group 1, those deadly diseases in childhood or severe malformations, the issue would be, or what we will be most concerned with, would be prevention. Since we can't treat these persons, these newborns or young children are going to die. And so we will want to prevent them from coming into the world, because since they're going to die in the few weeks or months of life, it will cause so much anguish and depression in the parents that we would want to give them the choice of not bringing those children into the world, because they will fall into category 1. And so we're trying to prevent such babies from being conceived. This would therefore involve premarital examination and counseling. We examine the couples before, test them for the genetic diseases, and counsel them if their offspring are likely to fall into category 1. For group 2, category 2, viable if treated hereditary diseases, most of these diseases are amenable to currently available treatment, such as virus-based gene transfer to the lungs of persons with cystic fibrosis. We touched on that in the earlier podcast, treating genes, using gene treatments to cure diseases. And so we could use gene transfer to correct the abnormal gene in the lungs of cystic fibrosis patients. It is very expensive, but it can be done, and it is being done in certain industrialized countries where the resources exist. And of course, in this category, we also find hemophiliacs, and we find that there is blood and platelet transfusion for hemophiliac patients. And so this category consists of viable if treated. If you treat them, these persons can live. The hemophiliacs can live, and so on, if we treat. So that's the category 2. If we look at category 3, this is called the late appearing genetic diseases. Now, these present more difficulties when we seek to counsel persons. For example, in the genetically inherited condition of Huntington's disease, this is a progressive disorder in which nerve cells slowly degenerate in the central area of the brain and therefore affect body movements. It affects a person's mood as well as their mental cognitive function, their ability to think clearly, make decisions. That is occurs in Huntington's disease. And so the person's life will be affected, but guess what? And this is why it falls into this category. It's called late appearing genetic disease. The person's life may be normal until the age of 38 or 40 years, after which these signs and symptoms begin to occur. So they live a normal life up until age 38, 40, and then the signs of Huntington's disease starts to occur. So all things considered, does this justify intervention and prevention? In other words, in counseling the parents or potential parents, should you bring these persons into the world and they live to be age 40 years normally, and then they begin to have Huntington's chorea, losing body movement, not being able to communicate because their brains, their mental cognitive function is affected, etc., etc. This is why I said counseling for this category is challenging. We should also note that other genetically inherited diseases do not appear until later on in life. Huntington's chorea is not the only one. Alzheimer's is another. This doesn't occur until later on in life. How should we counsel persons in regard to these late onset possibilities? For group 4 now, these are called the predisposition genes, such as the genes for cancer and the genes for schizophrenia. We have to distinguish between genetic disease and genetic susceptibility. When we wish to counsel for group 4, we have to let the patient or the potential parent understand a genetic disease is what you see. It's an abnormality. it is what you see. And then there is a genetic susceptibility, the likelihood of it occurring or not. You're susceptible to it happening, but it may not occur. As a result, counseling will involve calculating the risk probabilities for a disease occurring. And these probabilities will depend on the person's way of life as well as their particular environment. Gene changes will increase a person's susceptibility to certain cancers, as well as to certain psychiatric diseases. And these are important. But counseling will have to take into account the many uncertainties that exist for these diseases eventually happening. And that's for group 4. It is predisposition, but you may get the full disease or you may be just susceptible but don't manifest. And we have to calculate for these types of inherited type 4 genetic diseases that we have to say you're susceptible, you may develop certain cancers, you may develop certain psychiatric disorders, but may not happen. And we do that risk calculation in providing that type of advice for group 4. The last group, group 5, are the genes that are multifactorial diseases, such as cardiovascular disease and diabetes, as well as other nutritional conditions. And they actually involve diseases that are most frequent in the human population. Let me repeat that. The abnormalities that occur in group 5 are actually the most common in the human population. These are the multifactorial diseases such as heart attack, cardiovascular disease, diabetes, and certain nutritional conditions. So they are multifactorial. In other words, they are caused by many factors, but may also involve many defects in genes. For example, we know scientific research has shown that 6 defects in certain genes cause diabetes. And for heart disease, there are even more defects more genetic defects that can cause heart disease and heart attacks. And that's why some young persons, some young men may get heart attacks early in life and die. And when you trace it, you realize their fathers also had died early because of heart attacks. These are the genes that are passed down in the families. And so, while detection of one or several defects may be valuable in family genetic studies, they do not allow us to properly evaluate the increasing risk of getting the particular disease in specific individuals. Very importantly, a person's lifestyle and their environment play a considerable role in the process. And so genetic counseling will do the analysis of all of these factors, see which category your particular inherited gene falls into, and then provide you the advice in regards to both your environment, in regards to your lifestyle, and the likelihood of this occurring. This is the critical areas covered by genetic counseling. So I will now end today's podcast on these issues. And in my next podcast, I will look at some of the ethical issues involved in genetic counseling. These will address what is permissible and what is not permissible and ought not to be done. That's what ethics is all about. What we should do, what we ought to do, and what we should never do. Thank you for joining me today. I hope you have benefited greatly in our discussion of genetic counseling, and look forward to you joining me next week for my next podcast.